Today I will be treating a case of bilateral osteoarthritis in a 61-year-old lady. In the right knee, she has got multiple loose bodies. I will be doing an arthroscopy at first to remove the loose bodies. After that, I will close the arthroscopy wounds and I will be injecting platelet-rich stroma into both knees. She has been suffering from arthritis of both the knees for several years. MRI scans show grade to grade 3 cartilage lesions in both knees, in both the medial, tibial, femoral and patellofemoral compartments. These are the x-rays of her right knee, AP standing. You can see loose bodies here in the intercondylar notch and one on the inner side of the knee. The joint space on the inner side is narrowed in both the knees. You can see bone spur formation in both the inner and outer compartments here and here, which are suggestive of tricompartmental osteoarthritis. This is not a suitable case for an osteotomy, and the x-rays do not warrant a total knee replacement at this point of time. Therefore, with the present evidence, stromal vascular fraction therapy, a platelet-rich stroma, is the ideal treatment in this lady. Knee arthroscopy, you are now visualizing the patella. You can see that there are grade 3 changes in the medial patellar facet, and now you are seeing the lateral facet, which has got grade 2 changes here. And then you're going to see the trochlea now. The trochlea has got grade 2 articular changes. This is the this is the trochlea. You can see grade 2 changes in the entire trochlea. Now you are seeing the medial compartment. You can see ICRS grade 3 change in the medial femoral condyle and grade 2 change in the tibial plateau. You can see the loose body there. The same is being removed now. You can see some osteophytes in the medial aspect of the lateral femoral condyle. These will be removed with a burr. A curette is being used to remove osteophytes from the lateral femoral condyle. We are now probing the joint to see if there are any more loose bodies behind the ACL and the PCL. Now you are seeing a grade 3 ICRS cartilage change in the weight bearing part of the lateral femoral condyle. A mini liposuction is done on both the thighs to harvest fat. The harvested fat is centrifuged to prepare stromal vascular fraction. Stromal vascular fraction has been prepared. Injection of the right knee. Note that the arthroscopy wounds have been closed. Similar injections are performed in the left knee also.